Today we will examine the neck swelling in detail. So we broadly divide the neck swellings in two groups. One is the thyroid neck swelling and the other one is non-thyroid neck swellings. Thyroid swelling, which is present in front of the neck, spanning the front area of the neck, and the non-thyroid neck swellings can be either the thyroglossal duct cyst or the other neck swellings. What are the other neck swellings which are not thyroid in origin? वेरी गुड. लिम्फेडिनोपैथी हो सकती है, सेबेशियस सिस्ट हो सकती है, लाइपोमा हो सकता है, सिस्टिक हाइग्रोमा, डर्माइड सिस्ट हो सकती है in midline. These are the non-thyroid neck swellings. So the protocol of non-thyroid neck swelling is different from the thyroid swelling. We will discuss and do the examination in that context in this patient. What is the command in case of neck swellings? Command is the examine the swelling in the neck of this patient and do the relevant examination. Okay, so if you look closely in this patient, there is swelling over the lateral aspect of the neck. Nazar aa rahi hai? So the components of the examination are same in the swelling. After introduction and consent, we will ask for the proper exposure for the examination of this swelling. Then the chaperone, if the patient is a female or examiner is of the opposite gender. Then the components of the examination itself, that is the inspection, palpation, percussion and auscultation if applicable. In carotid body tumors, we have to auscultate, but we will omit in this swelling. So starting with the introduction and consent. अस्सलाम वालेकुम, मेरा नाम डॉक्टर तैयब है। ਤੁਹਾਡੀ ਜਿਹੜੀ ਰਸੌਲੀ ਹੈ ਮੈਂ ਇਹਦਾ ਮੁਆਇਨਾ ਕਰਨਾ ਤਫਸੀਲ ਦੇ ਨਾਲ ਤਾਂ ਕਿ ਸਾਨੂੰ ਪਤਾ ਲੱਗ ਸਕੇ ਕਿ ਕੀ ਚੀਜ਼ ਹੈ। ਹਾਂਜੀ ਹਾਂਜੀ, ਤੇ ਤੁਸੀਂ ਸਾਡੇ ਨਾਲ ਤਾਵਨ ਕਰਨਾ ਹੈ। ਮੇਰੀ ਕੋਸ਼ਿਸ਼ ਹੋਏਗੀ ਤੁਹਾਨੂੰ ਘੱਟ ਤੋਂ ਘੱਟ ਤਕਲੀਫ ਦਈਏ, ਠੀਕ ਹੈ। After the proper introduction and consent, this is the way of introduction and consent. Patient को comfortable रखना है आपने. Then I will ask the examiner for proper exposure till the nipple levels. So up till nipple levels there should be the proper exposure, because if the swelling is very large and huge, there will be the engorged neck veins and the prominent veins can present over the upper chest. So we need to have the proper exposure. So starting with the inspection. During the inspection, look at the swelling all around. First from the front of the neck, then from the side of the neck. During inspection, you need to have an idea that in which triangle of the neck this swelling is present. Then must have the inspection over the opposite side. Whenever you find a swelling over the lateral aspect of the neck, must have a look over the contralateral side of the neck. So on inspection, there is a prominent swelling over the right lateral aspect of the neck. It is present over the upper aspect of the sternocleidomastoid muscle. During inspection, we need to observe any discoloration over the swelling, any visible veins, any pulsations, any scar mark of the previous surgery, or any scar mark of the FNAC or true cut biopsy, and any ulcer or discharge, any prominent veins in the surrounding area, and any other swelling in addition to this swelling, any obvious deformity in the facial region, because this swelling may involve the relevant cranial nerve. So you should have an idea that what cranial nerve can be present at this site and what can be the deformity related to that nerve. So we should know that the spinal accessory nerve is usually present at this site. You should have the inspection over the trapezius muscle of the ipsilateral side, whether there is any atrophy or hypertrophy, and must compare it to the contralateral side. So all of it is the part of the inspection. Now we are going to do the palpation. Before palpation, ask the patient for any tenderness in this swelling. ਇਹਦੇ 'ਚ ਹੱਥ ਲਾਇਆ ਦਰਦ ਤਾਂ ਨਹੀਂ ਹੁੰਦੀ? नहीं है. So there is no tenderness or pain in this swelling. Patient has just demonstrated and examined the swelling himself. If the environment is cold, warm your hands before examining the swelling, before palpation of the swelling. First of all, check the temperature. Temperature should be checked with the back of the hand. First, check the temperature over normal skin, then over the swelling. After checking the temperature, ask the patient to have a slight ipsilateral relaxation of the neck muscle so that you can have the better palpation. Consistency, it is firm to hard in consistency. Then surface of the swelling, whether it is smooth surface, bossylated or irregular surface. Then margins of the swelling, all around, edges and margins. The swelling has irregular margins, they are not smooth margins. So, then overlying skin pinchability. Check whether the skin is pinchable over the swelling or the swelling is adherent to the skin. Then mobility of the swelling over underlying structures. Check the mobility in two planes, horizontal plane and vertical plane. This swelling is not freely mobile. You can have an idea. It is not a freely mobile swelling. It is somewhat adherent to the underlying structures, firm to hard in consistency, irregular borders. Then the very important point, that is the size and dimensions of the swelling. With the help of measuring tape, take the size. First, you have to define the dimensions of the swelling. For example, this is the horizontal limit of the swelling. So you need to take the size in this manner. This is the 0. So 0 will come over this limit and this. So this is the exact way to take the measurements of the swelling. This is the wrong way to take the size. If you take the size in this manner, it is going to be about the 8 or 9 centimeter in size. But if you take the size in correct way, like this manner, it is around 6 centimeter swelling in the horizontal plane. Then in the vertical plane, these are the dimensions and limits of the swelling. In vertical plane, again it is 6 centimeter. So this is 6 into 6 centimeter swelling. This is the size of the swelling. Then the compressibility. Compress the swelling for 2 to 3 seconds and check whether it vanishes or not. Obviously, this is a firm to hard swelling. I'm not suspecting it to be originating from any vessel. The swellings which are arteriovenous in origin, like hemangiomas or AV malformations, they are compressible. So I am not expecting the compressibility in this swelling. Obviously, fluctuation will be negative in this swelling because it is firm to hard. What about transillumination? We will not do the transillumination in this swelling. Why? Because it is not soft in consistency, it is not fluctuant. So you will omit the step of transillumination. It is very important. If you are going to do the transillumination, then how will you defend yourself during the viva or when you are going to narrate your case? So if the swelling is non-fluctuant, it is firm to hard in consistency, you are not going to do the transillumination. It's obviously going to be the negative in the hard swelling, which is not cystic in nature. So we have completed the examination of the swelling. We have completed the inspection and palpation. Then is the percussion. Percussion will be not done in this swelling. Then the auscultation. I told you that if we are suspecting this swelling to be originating from the vessel artery, then we will do the auscultation, which is not in this case after inspection and palpation. Now the next component is the relevant examination. The relevant examination would be the examination of the regional lymph nodes, examination of the relevant cranial nerve, examination of the relevant joint movements. Like in this case, it would be the movement of the temporomandibular joint, and sensory motor examination of the muscles and skin of that region. This is the relevant examination in case of head and neck swelling. First of all, we will do the examination of the cervical lymph nodes, cervical lymph node examination. So, for the examination of the cervical lymph nodes, you should know the levels of the cervical lymph nodes. What are the levels? Submental lymph nodes is the level 1A. Submandibular lymph nodes is the level 1B. Then examination of the ipsilateral cervical lymph nodes. Upper cervical, upper jugular lymph nodes. This is the level 2. Middle jugular lymph nodes, level 3. Lower jugular lymph nodes, level 4. Remember to palpate these lymph nodes along the anterior border of the sternocleidomastoid. Then repeating on the opposite side. Level 2 lymph nodes include the upper jugular and upper spinal accessory. Then the level 3 lymph nodes, which are middle jugular lymph nodes. Then the level 4 lymph nodes, which are the lower jugular lymph nodes or jugulo-omohyoid lymph nodes. Then the level 5. Level 5 is posterior triangle lymph nodes, posterior cervical lymph nodes in this region. Level 5 are further divided into two, 5A and 5B. 5A and B, which are the inferior spinal accessory lymph nodes and the transverse cervical lymph nodes. These are the level 5A and B. Similarly, on the opposite side, level 5 posterior cervical lymph nodes. Then the anterior compartment, level 6 lymph nodes, pretracheal and prelaryngeal lymph nodes. These are the level 6. Then the level 7. Level 7 is the infraclavicular and the upper mediastinal lymph nodes. These are the level 7. So these are the levels of the cervical lymph nodes. For the examination of the level 2, 3, 4 lymph nodes, examine one by one, not simultaneously. You can induce the vasovagal syncope if you massage the bilateral carotids. After lymph node examination, we will examine the movement of the ipsilateral temporomandibular joint. Put your index finger in the ipsilateral ear canal, pulp facing forward, and ask the patient to open and close the mouth. अब मुंह खोल के ना मुकम्मल पूरा फिर बंद करो, पूरा मुंह खोलना है, फिर बंद करो. So joint movement is normal and not restricted. Then superficial temporal artery pulsations, because the artery is having the course just beneath this swelling, so we want to have an idea whether that artery is involved by the swelling or not. So where to palpate the pulsations of the superficial temporal artery? Between the tragus and the helix, in front of the tragus and helix. I can feel the pulsations. The artery is not involved. Then the movements of the trapezius muscle, because the spinal accessory nerve is part of this region. I told you that this is part of the relevant systemic examination. So I will ask the patient to shrug the shoulders against resistance. First I will demonstrate the patient. ਇਹ ਦੇਖੋ ਮੇਰੇ ਵੱਲ, ਇਹ ਦੋਵੇਂ ਕੰਧੇ ਉੱਪਰ ਇਸ ਤਰ੍ਹਾਂ ਕਰਨੇ ਆ, ਠੀਕ ਹੈ, ਜਦੋਂ ਮੈਂ ਕਹਾਂਗਾ। ਸੋ ਆਫਟਰ ਦੀ ਡੈਮੋਨਸਟ੍ਰੇਸ਼ਨ, ਚਲੋ ਚੁੱਕੋ, ਉਹ ਹੋਰ ਉੱਪਰ ਲੈ ਕੇ ਜੋ ਕੰਧੇ ਥੱਲੇ ਕਰ ਲਓ, ਠੀਕ ਹੈ, ਨਾਰਮਲ। The spinous accessory nerve is intact, and I have also checked the power of the muscle. The power of the muscle of this region is 5 by 5 because patient was able to shrug the shoulders against the resistance. Then the sensory function, ਅੱਖਾਂ ਬੰਦ ਕਰੋ ਜ਼ਰਾ, ਤੁਸੀਂ ਦੱਸਣਾ ਉਂਗਲੀ ਕਿੱਥੇ ਲੱਗ ਰਹੀ ਹੈ। ਹੌਨ ਹੌਨ ਇੱਕ ਜਿੰਨੀ ਮਹਿਸੂਸ ਹੁੰਦੀ ਦੋਵਾਂ ਪਾਸੇ, ਠੀਕ ਹੈ। ਸੋ ਦ ਸੈਂਸੇਸ਼ਨਸ ਆਰ ਇੰਟੈਕਟ ਐਂਡ ਇਕੁਅਲ ਬਾਇਲੈਟਰਲੀ। If this swelling is the lymph node mass, then what are the areas to examine in the head and neck region? What are the causes of cervical lymphadenopathy? Primary, it can be infective, acute infection, or chronic infection. Acute infection कौन सा हो सकता है? Acute bacterial and viral infection of the nearby area. Chronic infection can be either the tuberculosis, sarcoidosis, or the another cause of primary lymphadenopathy is the lymphoma, malignant cause. Primary benign and primary malignant. Primary benign में acute infection and chronic infections. Primary malignant में lymphoma. Secondary causes. Secondary causes क्या हो सकती हैं? These can be the metastatic lymph nodes. Metastatic lymph nodes. Primary tumor is present at somewhere else, and these are the metastatic lymph nodes. Primary tumor can be either in the head and neck region or below the clavicles. On the basis of the involvement of lymph node group, we can have an idea whether the primary is in head and neck region or below the clavicles. If the level 1, 2, 3 lymph nodes are involved, or posterior cervical lymph nodes are involved, then the primary is in the head and neck region. If the supraclavicular lymph nodes are involved, then primary can be below the clavicles. Like, what are the primary sites below the clavicles? Breast cancer, lung cancer, esophagus and stomach cancer. In case of stomach cancer, left-sided supraclavicular lymph nodes are enlarged. They are called the Virchow's nodes. Virchow's nodes आपका टेस्ट हुआ है ना, पढ़ा होगा। Ovarian carcinoma and the testicular carcinoma, prostate carcinoma. These are the carcinomas या primary sites below the clavicles, जिनमें ये supraclavicular lymph nodes enlarge हो सकते हैं. Talking about the head and neck primary sites, they can be the oral cavity carcinomas like the floor of the mouth, tongue carcinoma, carcinoma of the tongue, tip of the tongue, base of the tongue, laryngeal carcinoma, oropharynx carcinoma. Then the salivary glands, ये parotid and the submandibular gland carcinoma and the thyroid carcinoma. These are the head and neck areas of primary if the nodal mass is metastatic. So we will going to examine all these areas. Starting from the scalp skin, check for any ulcer or wound, because there can be the basal cell carcinoma ulcer, due to which there can be the enlargement of the lymph node. So you have to examine the scalp skin thoroughly. After the examination of the skin of the scalp, we are going to examine the cavities, all cavities, nasal cavity, ear canal and oral cavity. Remember the cavities: skin of the scalp, then cavities. We want to examine the cavities for any infection and primary sites of the carcinoma. So, ear canal, check whether there is any pus discharge or infection in the ipsilateral ear. Then the nasal cavities, any nasal canal carcinoma. Then the oral cavity, मुंह खोलो. Examine the tip of the tongue, base of the tongue, floor of the mouth. जुबान ऊपर चुको, ऊपर हाँ, floor of the mouth. Then you should have the tongue depressor to examine the back of the tongue. What areas we can further inspect in the oral cavity? We need to have the laryngoscope, indirect laryngoscopy, to examine the further backward areas of the oral cavity like oropharynx, base of the tongue, fossa of Rosenmuller. This is the most common site of head and neck carcinomas. That is the fossa of Rosenmuller. Then the piriform fossa, then the tonsillar fossa. So all these areas we need to examine via indirect laryngoscopy. Then after the examination of the all cavities, if the lymph nodes are present in the supraclavicular areas, we will also examine the abdomen of the patient. In females, breast examination. In males, testicular examination. Okay? But as the lymph node group in this area, in this patient, is at the level 1, there is no need to examine all these areas. Another important thing is the examination of the rest of the lymph nodes. In addition to the cervical lymph nodes, when will you do the examination of the axillary and inguinal lymph nodes? If you are suspecting lymphoma, if the swelling is present in the posterior triangle level 5, because in lymphoma level 5 lymph nodes are enlarged. This is not the level 5, it is level 1. So if level 5 lymph nodes are enlarged and the lymph nodes are discrete, multiple, then you will have the suspicion of lymphoma and you will examine the axillary lymph nodes, you will examine the inguinal lymph nodes, you will examine the abdomen to look for hepatosplenomegaly, because in lymphoma there can be the hepatosplenomegaly. After that, we can auscultate the chest of the patient and examine the back of the patient. मुंह इधर कर लो जरा. Chest auscultation as part of the metastatic examination. Ask the patient to cross the arms for better auscultation. ਇਹ देखो जरा दोवें बाजू इस तरह रख लो. So chest auscultation, then palpation of the spine. Ask the patient to tell you whether he feels any pain in the spine. कोई दर्द तो नहीं है इथे? Spine palpation for tenderness if there is metastasis into the vertebra, because the head and neck carcinomas, they metastasize most commonly to the vertebrae and liver and lungs. At the end, say thanks to the patient and cover the exposed area. बहुत शुक्रिया जी, तुसी साडे नाल तावन कीता. How to narrate this case? Now examiner will ask you to narrate your findings. A middle-aged male sitting comfortably on the bench, well oriented in time, space, and person, well cooperative. He is having a 6 into 6 centimeter hard, non tender, normothermic swelling over the lateral aspect of the neck in the region of the angle of the mandible over the right side of the neck. This swelling is firm to hard in consistency. It is having irregular surface, irregular edges and margins. Overlying skin is pinchable. The swelling is fixed to the underlying structures. It is non-compressible swelling. The examination of the rest of the cervical lymph nodes is unremarkable. Examination of the scalp, skin, ear canal, nasal cavity, and the oral cavity and the oropharynx is unremarkable. The movement of the ipsilateral temporomandibular joint is not restricted. I could feel the pulsations of the superficial temporal artery over the right side, and the power of the regional muscle group, that is of the trapezius, is 5 by 5. Examination of the chest and spine is also unremarkable. That's it. Thank you.